Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and we say all the time in the office, Medicare is the air we breathe. It's our thing. It's what we do each day. And I wanted to do a short video with you just to explain what is a Medicare Supplement Plan G. It's the most popular Medicare supplement plan today, and I wanted to show you how it works with Medicare, what gaps it fills with Medicare, and how it works. But before we get into a Plan G, I just want to do a brief overview of original Medicare, what Medicare covers, maybe more importantly, what it doesn't cover, just so you understand how a Plan G fits and why it's so important. So when we talk original Medicare, there's two parts, Part A and Part B. Part A of Medicare is your hospitalization. So anytime you're admitted to a hospital, Part A is kicking in. Part B is everything outside the hospital, your primary care doctor, specialists, emergency rooms, even outpatient procedures. All of that falls under Part B of Medicare. Part A of Medicare, all of these years you've been working and they're pulling money out of your paycheck for taxes, the portion of your taxes that went to Medicare paid for Part A. It's already been paid for. You already bought it. I never tell anybody Part A of Medicare is free because it absolutely was not free. You had to pay for it, but it's already been paid for. So going forward, there's no premium for Part A of Medicare. You turn 65, you're entitled to Part A, you can sign up for it, and it's already been paid for. Now, what does it cover? What does it not cover? Part A of Medicare, when you're admitted to a hospital, day one, you have a deductible of $1,632. This deductible will cover you for up to 60 days. The catch is it's not an annual deductible. So what that means is if you're admitted to a hospital and you pay that $1,632 and you're there for a few days, you go home, let's say a few months later you're back in the hospital, well, you pay this deductible again. So you could pay that deductible several times in a year if it's a rough year health-wise for you. If you're in there for over 60 days, now you have a per day copay of $408. And if you're in there for over 90 days, that per day copay doubles to $816. Skilled nursing is also under Part A of Medicare, and skilled nursing is basically a place to recover. So if you have some type of a life event, like a heart attack, a stroke, or let's say you have a hip replacement, and your doctor says you're stable, but you're not quite ready to go home. Well, oftentimes they're going to move you to a skilled nursing facility, and this is where you're going to have registered nurses taking care of you, and you're going to have your physical therapy and your speech therapy, your occupational therapy, and things like that until you're ready to go home. Medicare covers the first 20 days, so you pay nothing for 20 days. After 20 days, now you have a per day copay of $204. That's a little bit of a picture of your out-of-pocket exposure with Part A of Medicare. Part B of Medicare, I do want to explain, it comes with a premium of $174.70. This is the standard premium in 2024. This can go up based on income, and for more information on that, check out our video on IRMA, the income-related monthly adjustment amount. But most people are paying $174.70. If you're drawing Social Security, they just take that out of your Social Security check. If you're not, they're going to bill you quarterly. So take $174.70 times 3. You're going to pay it every few months until you just start drawing Social Security. So Part B of Medicare has its own deductible of $240. This deductible is different from your hospital deductible in that it's annual. You just pay it one time a year. Once that's been paid, well, now Medicare's kicking in and they're going to pay 80%. While you're paying 20%. So anytime you see a healthcare professional, you're paying 20%. The big issue with this is you have no max out of pocket. So if you have a health condition come up where you're going in for regular treatment and often, you're going to keep paying this 20% without any stop loss. There's no ceiling. So there's no cap in your out-of-pocket exposure. These costs are why people get a Medicare Supplement Plan. They're also called Medigap policies because we're filling the gaps of Medicare. Now back to the Plan G. Where does a Plan G fit in? It's one of your Medigap options, your Medicare supplement options. And when you combine it with Medicare, this is what your out-of-pocket exposure looks like. So when you're admitted to a hospital, that $1,632 deductible, it's paid for you. That Plan G is going to pick it up for you. If you're in there for over 60 days or over 90 days, these per day copays, those are covered for you. Your skilled nursing copay, if you're in skilled nursing for more than 20 days, that Plan G is going to pick up where Medicare left off. And basically, when you combine a Plan G with Medicare, you have no network. So any healthcare provider in the United States that takes Medicare will also take this Plan G, and they're going to pick up all of the costs where Medicare leaves off. It's really dynamite coverage. Now, outside of the hospital, under Part B of Medicare, outside of the hospital, you do still have to pay this annual deductible, the $240, but remember, it's annual. So you're just paying that $240 one time a year. Once that's been paid, now Medicare's kicking in. They're paying 80% anytime you see a healthcare professional. And these 20% that you're left with, this Plan G picks up for you. So after you've paid that annual deductible, anytime you see a healthcare professional, it's going to be zero copay. This Part B excess charge, what that means is if a healthcare provider accepts Medicare, that means they're accepting the Medicare approved amount for the services they provide. Now, they are allowed to, if they choose, charge up to 15% more than what Medicare assigns them. And if they do, if they charge this 15% extra, without a supplement, without a Plan G, you have to pay it. With a Plan G, that's covered for you. So the long and short with a Plan G is when you combine a Plan G with Medicare, you have no network, you have an annual deductible of $240, and that's it. I mean, it's really dynamite coverage. It's great coverage. Now, if you have questions on what companies offer the Plan G in your area, what premiums these companies charge, we would be more than happy to walk you through all of your different options with the Plan G among other supplemental plans. We can dialogue on Medicare Advantage if you have questions on that. You can call our office, 316-260-3331. We'd be more than happy to walk you through the different options that you have, what companies offer the Plan G and what premiums they charge. I also want to mention that I have this book that I wrote called Medicare Made Simple, where we break down Medicare, what it covers, what it doesn't cover, what supplemental options you have, how those work with Medicare, what is Medicare Advantage, is it to your advantage to sign up with a Medicare Advantage policy, just the ins and outs of Medicare, because health insurance is really important. It is a big deal, and you want to feel confident in the coverage that you have. So if you would like a free copy, no obligation, free copy of this book, Medicare Made Simple, just give our office a call, 316-260-3331. We'll ship it to you, no questions asked. You can read through it. We hope that it's a blessing for you because health insurance is a big deal. All of this is so that you can make an informed and confident decision. Any questions you have, give us a call today. We'd be more than happy to help. I hope you found this video helpful. I appreciate you watching. Let us know if we can help.